Immediately after surgery, you may feel a little sleepy or drowsy, but most of our patients wake up in minimal pain. Again, I can't guarantee zero pain, but it should be manageable. You will have a nurse right there with you when you wake up, and of course, you'll see me and other members of the team that you've already met. Some people get nauseous or sick from the painkillers, but again, the nerve blocks that we use help to minimize the amount of drugs or anesthetic that the anesthesiologist has to give you, and they do a very comprehensive job of trying to prevent nausea and vomiting. But if it occurs, you have a nurse dedicated just to you in the recovery room to help you. On average, you'll be in the recovery room anywhere from 30 minutes to an hour. Occasionally, if the hospital is full, you may need to stay in the recovery room longer than you need if they don't have your room ready for you just yet. Once you leave the recovery room, you will go to a room where your family member has already been escorted, and you will meet your floor recovery nurse. Most people stay in the hospital at least one night. Depending upon your condition or capacity before the surgery, you may need to stay in the hospital 2 or 3 nights. The average is two, and there are some patients who qualify for outpatient surgery depending upon your medical history. When you wake up, your leg will be numb from the nerve block that we had talked about prior to the surgery. I've also injected the inside of your knee with the numbing medicine that lasts about 3 days. You're still able to move, and if you have what we call breakthrough pain, then you can ask your nurse for either a pain pill for moderate or medium level pain, or if you do have that severe breakthrough pain, then you can get a pain injection, and we usually use morphine, but we also use other intravenous medications that you will get on a scheduled basis, which are non-narcotic, non-opiates, which work really good for pain control, but don't have the side effects of those other medications. Blood clots are prevented starting right at the time of your surgery. When you are asleep in the operating room, we use specialized equipment that massages your legs to keep your blood circulation going to prevent clots. Also, clots are prevented by mobilizing you or getting you out of bed, sometimes on the same day as your surgery, and even walking down the hall. We also use medications which we start the day after surgery to help keep your blood thin, because that's when we know that the clots can form as well. Many patients can have low blood pressure immediately after the surgery. That's because the medications that we use to put you to sleep can dilate your blood vessels, which lowers your blood pressure, in addition to some of the pain medicines that we use can lower your blood pressure. So if you see that I have modified the dosages of your blood pressure medicine that you may take prior to coming into the hospital, don't panic. We look at all of your medications and adjust them to the blood pressure, which we are continuously monitoring. Physical therapy starts most often on the very day of your surgery. If you're feeling well, meaning not nauseated, then we have the physical therapist help get you up on the day of surgery. And most of our patients even walk down the hall on the day of surgery. Your physical therapy goal is to be able to get in and out of bed safely on your own. And when you can walk 100 feet and get to the bathroom on your own, that's when we talk about discharging you from the facility to your home. When you wake up from the surgery, you will have a brace on your leg to help stabilize it while the nerve block is still active. You will also be fitted with a walker and or crutches by the physical therapist to help you get around safely. You really don't need any other specialized equipment other than perhaps ice packs or an ice machine. We also fit you with a compression stocking and or ACE wraps, which help to minimize swelling in the leg. The less swelling you have, the less pain that you will have. An incentive spirometer is a device that helps you exercise your lungs in the immediate post-op period. Having anesthesia and staying in bed and not being mobile helps secretions to collect in your lungs and cause some lung congestion. So if you're taking deep breaths, which the spirometer encourages, then that helps to minimize any temperatures and it helps you to recover faster and more safely. Cold therapy is a specialized type of machine that has a wrap that you put around your leg and it circulates through hoses cold fluid, which helps to ice down or decrease the temperature on your leg, which helps to minimize swelling and pain. Sequential compression devices are those leg massagers that I was talking about. What they do is they simulate your natural muscle action, which helps keep your circulation going. For example, when you're walking, your muscles are constantly moving the blood through your legs, but when you're sedentary or immobile, that blood is not circulating or moving as much, and that's how blood clots can form, and the sequential compression devices help to prevent that. They are not painful, though some people say the sound of the machine can be annoying, but they are essential for a safe recovery. You will be discharged when we see that you can get out of bed on your own and safely walk 100 feet. The other parts of the discharge process involve a case manager, which is a dedicated nurse who comes and talks to you and your family and caregivers privately to make sure that you have all the resources you need for a safe transition to your home environment. We usually discuss the discharge plans on a daily basis, and most of the time we know the night before when you're going to be discharged. Of course, we make sure that your temperature, blood pressure, and all your vital signs are where they need to be before we have you leave the facility. You will be given a list of the medicines that you should resume taking after the surgery. Again, sometimes we have you discontinue or temporarily hold some of your preoperative medications. The new prescriptions that I will give you will be for the blood thinner, which is a prescription, and will have investigated with your insurance prior to the surgery which blood thinner is the most economical and available for you. You'll also get prescriptions for nausea. I also prescribe vitamins, which help with healing and helping with restoring your blood count. Because even though transfusions are rarely necessary these days, you do have some bleeding with the surgery, and adding the vitamins and emphasis on good nutrition helps you in recovery. The other prescriptions are for pain medicines. We do prescribe opiates, but we use them in much less quantities these days, and we also give you non-opiate pain prescriptions and advice as to how to judge which ones to take and how to utilize them safely.